afternoon, everyone. Before we begin, I'd like to take a moment to read UMass Chan's land acknowledgement. UMass Chan Medical School acknowledges that its campus is located on the lands that were once part of the original homeland of the Nipmuc people. We denounce the violence that stripped these original stewards of lands that were their ancestral home and denied their descendants the opportunity for an authentic connection to it. In making this acknowledgement, we announce our intention to listen to and to follow the lead of our Indigenous neighbors and to work together to create new legacies of equity and respect. I'm excited to welcome you all to our webinar today, Why Environmental Justice is a Public Health Issue. My name is Courtney Roten, and I work for the Office of Sustainability here at UMass Chan. Our office is thrilled to collaborate with the Diversity and Inclusion Office on this event on this very last day of Earth Month. I'd like to introduce Marlena, our Vice Chancellor for Diversity and Inclusion, who has a few opening words for us before we jump in.
Thank you, Courtney, and welcome everyone to our event this afternoon. It is my pleasure to welcome you all. So today we will be discussing the intersection of environmental justice, climate change, and racial justice. This topic is a critical one that demands our attention. Climate change is not just an environmental issue, it is also about human rights and public health. We have the pleasure of being joined today by our distinguished guest, Crystal Johnson, who is a passionate advocate for environmental justice and currently serves as the Assistant Secretary for Environmental Justice at EEA. Our discussion today will be moderated by Janine Cook, and we will leave time for question and answers at the end of the talk. So again, welcome, and I will send it back over to Janine.
Thank you. Thank you so much, Marlena. And welcome to UMass Chan, Crystal.
Thank you so much. I'm so excited to be here for so many reasons. I'm mostly thrilled to engage for all the people who've taken the time to be here. And I value as healthcare practitioners or leaders in that industry, helping to shape next generation of leaders. And I'm glad to be part of this conversation to bring my experience, expertise, insight to help everybody here in the health industry understand the correlation to environmental issues, public health issues, environmental justice, and equity. So thank you.
Wonderful. So I've had the pleasure to start to get to know Crystal and hear more about the work that you do. And now I want to just give you the opportunity to share who you are, more about your work, and why it's important to you with the rest of our UMass Chan community.
Thank you so much. That's a great question. So while I have the honor of serving with the Commonwealth of Massachusetts Executive Office of Energy and Environmental Affairs, Office of Environmental Justice and Equity as the Assistant Secretary, my background is in environmental planning. So for 30 years, I've been a senior environmental planner, which means that I've always had to recognize environmental health issues as public health issues, and that I also have an energy background and being able to bring all that together for environmental justice and equity under this administration. The Haley Driscoll administration has been profound in having a clear message regarding including environmental justice and equity across the board in everything that is done, particularly around energy, environment, and climate planning. So the work that I do now has a few different facets. We have work that we work with within the EEA. There are 12 different agencies and offices, some of them, from Department of Public Health to DEP and MEPA and others. And they are under the umbrella Office of the Secretary. So we work with them on making sure there's an environmental justice and equity lens on their programs, their grants, their best practices, policy, anything that they're touching. And since the administration has been here for a little bit over a year, it's been an impactful year of coordinating and clarifying what is that process. So that's the one thing that we're focused on that way. But we're also focused on ways that we work with the communities and how that we engage and create new pathways of engagement. We're focused on an environmental justice strategy that I'll get to. But the work, again, is very multifaceted. There's never a dull day, which I enjoy. And part of that work is also engaging with diverse stakeholders, which UMass Chan is, everybody here is. And so this is the joy that I love of the work is it's great to do the policy. It's great to help people with their programs and grants with an equitable lens, but to engage with the healthcare students here and the faculty and other, this is really what it's about, because you're having a conversation and planting seeds to help an industry advance forward so they have stronger impact, have great clarity, and are part of the solution, and they understand how to do that. So I'm glad to be here, and that's part of the work that I do.
That's so important, and thank you for sharing that. And just so that we make sure everyone here understands, and we're starting from the same place, could you talk a little bit more about how you define environmental justice and equity?
Sure, and we have some slides that I'll walk you through. So that's a very important question. Before we jump into it, I want to give the full context. And while there's ample information online, you can familiar yourself further, I still wanted to start with the history of environmental justice, because there's some misunderstandings, and just wanted to highlight a few aspects. So environmental justice, while it is very popular now, and it came very popular, particularly after certain summers of like 2020 and forward around equity, and it really propelled. It's always been there, but now it's getting the recognition that it deserves. So for decades, grassroots organizations have always said that their communities have been underserved. And the groups that are underserved are usually low income, sometimes moderate income, BIPOC communities, communities where you have people with disabilities, you have communities where there's language, energy proficiency is not their first language. There are many different aspects of a minority or underprivileged community. And some of that history, some people may not fully understand, but you go back to the 1960s and the early 70s, while there were some great movements happening around the environment, around like conservation, which is so needed, where you have like the Sierra Clubs and you have the Nature Conservancies, other groups that were starting to really advance, you also had something happening that was a lot quieter. And what was happening was this grassroots effort where minority communities, particularly, say at the time, Black American communities, were facing disproportionate environmental burdens, meaning because they didn't have economic power, they didn't have political power. And that in these communities, many times that community, that municipality itself, coupled with businesses, came in and allowed industrial businesses and practices to be in areas where they were right next to communities. And it's part of a whole redlining issue, a bigger systemic concern and problem. And what it was is that you begin to have communities recognize that while there was a history of always racism, it now became environmental racism, which also escalates it up to now families are being exposed to toxins in the air, to the water, and into the ground, and being exposed. And it's something that many people then said, wow, it's one thing to be exposed themselves, but they had families, they had children, and they organized, and they said, with much power, they stood up to the entities, and they were able to strategically organize and start to gain recognition. So that was happening in the early 70s. Still, there was not the term environmental justice. Also, I want to say that environmental justice has its origins and its roots in the indigenous environment movement. All of that comes into play regarding land rights. So in the 1980s, that's when you really saw the term environmental justice really coined and became a movement on its own. And really what happened there was in the 80s, there was a catalyst of, in North Carolina, a demonstration around a toxic landfill in which PCBs were being planned, and the community really fought back. And so that started at a different level, the publicity, the awareness, and it continued on and also became a global movement since then. Today, the environmental justice movement is all that it was, addressing the roots of environmental justice and injustices around environmental racism, but it's also at the intersection of different movements. And so we have, it's social justice with environment, climate. It's also with public health issues. It can be around workforce. It can be around food equity, housing equity. And so it is a intersectional approach that has many different facets. And that's one of the things that I enjoy. So when you think about environmental justice, the roots are in historic environmental racism, in which businesses were allowed to be close to communities, which again posed a public health issue, and these communities organized and fought back. And that's part of the history that I want to highlight. And we'll go to the next slide. The reason that is significant because it's helped shape some of the principles around environmental justice. And there are many different definitions from federal to, to state, and different states, look at them differently. But I want to highlight that there are principles that usually go across the board regarding environmental justice, yet alone in equity. And they're based on principles that everybody has a right to be protected from environmental hazards and to live in a clean and healthy environment. And that environmental justice was about equal protection from toxins and meaningful involvement. And that is around engagement, because many times before there was no engagement with the communities. The municipalities made decisions for communities, businesses made decisions with municipalities, but there was no involvement except that, oh, this is being placed here, and then usually they had to react. And that now is looking at, there has to be meaningful engagement and involvement, their voices heard. So those are new principles regarding environmental justice to make sure that as we have laws and regulations and policies, that it accounts for a more equitable distribution of environmental benefits as well as the burdens. So you have this way of benefits and burdens, and just highlight that. Benefits, like what could that be? You could have jobs, you could have rebates. We live here, we have our utility bills, we have nano pennies going out each month into ratepayer programs, and they used to be really designed for market rate. So for every dollar that a community, say maybe in Wellesley, had put in based on that bill, they were getting back, it's always recognized as more than that dollar in viable, relevant rebates. Whereas in other communities, many times they'd say could put a dollar in and they're getting less than that dollar back because the offerings were not relevant to that community. I'll give one quick example. You could have a rebate, like if you bought I'm making this up, a refrigerator for $4,000, you can get like $500 back. Well, there are not many people who are low or even moderate income or other who then say like, wow, I have this money, $4,000 to put out just to get a portion back. It's not relevant. And so that rebate and all that money goes towards funding that. But the other people where it's not targeted don't benefit from other offerings. So those are some of the principles to give you a frame. And we'll go to the next slide. So as I break it down from the history to the principles, now we're coming back to my office. So we have the Energy Environmental Affairs Office of Environmental Justice and Equity. And we have our own approach and commitment based on Haley Driscoll administration. And what it is that we're committed to ensuring a fair and equitable distribution of all environmental and energy benefits and burdens, as I mentioned. Benefits, jobs, rebates, burdens. What are you being exposed to? What's being cited in your area? And what we're doing is ensuring that the policy and programs within EEA are accounting for equity, and where it says ensuring all voices are heard and all voices are shaping the solution, that's rather new, and that's regarding having engagement before to work with community leaders in a wide range of organizations, saying, what do you think? What do you need? What is relevant to you? And having that shape then what that program is, rather than have it be done at a meeting somewhere else without local involvement. So we're excited for how everything has been reframed. One of the things that I will highlight is, as we move through, this is what the Office of Environmental Justice and Equity is focused on. Something key had occurred. There's a document out, and it's the Environmental Justice Strategy. It's like a 150-page document comprised of, smaller strategies for each of the 12 or so different agencies that I had mentioned, like Mass EC, DEP, Public Health, and so forth. And this document is the first in Massachusetts and somewhat the first in the nation. And it highlights what we are planning for the next 3 years, because it's a 3-year plan, regarding what we focus on. So each agency has their own focus, but there are some that have cross-cutting strategies, such as meaningful engagement is key. How are we doing trainings to our staff to make them aware of environmental justice and equity? You know, what does it mean because what it means in one office, because of how they engage with the community and what their benefits and burden potentially is different than from another one. So making sure people see how it's relevant and then how to move with that. We really value metrics and tracking. You have to have an understanding of a baseline so you can say is this effective or not. And those metrics help us determine, wow, what are the adverse impacts? You know, how are we tracking that? Something key that's also cross-cutting across all those agencies is language access, translations, you know, how we do our documents, how we have meetings. There are 10 languages that we look at when we have public meetings, and it's interpretation happening, it's documents being translated. So being hypersensitive that to make sure that people have the right information, that it's written in languages as needed to make sure that it's understood, it's clear. And the other part is analyzing project impacts and looking at that more in a cumulative way also. So those are some of the areas that go across all EEA, but each agency, including my agency, we have our own distinct ones also. So we'll move on from there. So that hopefully is a starting point for everyone to gain an understanding of environmental justice and equity, from the history to what's happening overall in Massachusetts and coming from the Office of Environmental Justice and Equity.
Yeah, wow, that is very powerful. And we will make sure that that report, if we haven't done already, is a resource for our UMass Chan community.
Especially over an annual report will be coming at the end of the year, but Department of Public Health has their focus, and it's growing because each of those agencies is at a different EJ journey starting point. There are some that have been doing this for a few years, some that are just new to it in the last year, some that have been doing it, effectively in some way, for like 8 years. And so it's exciting that we're bringing people together because we want to have some consistency, recognizing where everybody still is, and then driving it forward. And so just as we meet here today, everyone is on their own approach and understanding, and that's perfect. And just planting seeds to help you understand, and you guys can all connect and then figure out how to move together.
Yeah, that's great. So speaking about benefits and burdens, what are the key areas of concern in the state of Massachusetts and more relevant and locally here in Worcester?
Right. That's a great question. So in overall Massachusetts, as a northeast city along the water, for climate, looking at there's coastal resiliency, that's one. Then you have many issues around grid and energy planning. Something that's really large that I'll say is that while we're moving towards decarbonization and electrification, being very sensitive to that for some communities, especially in low moderate income, they may use gas. So then when you decarbonize and electrify, you're moving them to, some people want heat pumps. And our Office of Environmental Justice and Equity values climate resilience, climate adaptation, but balanced with saying we first have to address the energy burden for many low income, underserved, diverse communities, and want to first address what are those energy rates so that we're not then having people move to electric, their energy burden goes up. And energy burden may be some things that you may know about or not, but it's the percent of your energy bill in relation to your income. If you have $100 energy bill, for some people that's easy. For many people, that $100 bill or a spike can mean less food, it can mean less medicine, and that challenge of how do you balance that and all the implications. So we're aware of many different factors that shape what's happening here in Massachusetts. So those are a few. This map right here, is great. It starts to highlight in a color-coded way. You can see communities that could be recognized as EJ based on the yellow and gold with minority populations over a certain percent to certain incomes and English isolation. So it touches many of our municipalities in one way or the other. And the next map that we have then starts to break it down into, Worcester. And so you can start to see that in Central Mass area, what we're really looking at regarding, the populations, again, English, the income, as well as English isolation or the English proficiency. The next map, I think, comes closer to what's happening right here in Worcester. And Worcester definitely is an environmental justice community, again, because of the minority population, the income, and language isolation. And some of the big issues that are happening in this immediate area, we'll go to the next slide. These are just a few that really focused on, and not to say that there could still be others, but these are the main ones. Are the extreme heat is an issue, the urban flooding, and the tree canopy, and I'll break that down. So extreme heat, it's getting more and more intense. And that urban heat is really dangerous because as temperatures climb, you have vulnerable members of communities. And we can talk about that from elderly to young or anybody that has health issues, as well as if you're pregnant, it is exponentially worse and can impact in a strong way. And I know in Worcester, they took that seriously. They did heat risk assessment to help try identify the most heat vulnerable parts of Worcester and start to then come up with different solutions for like cooling centers. How can we get more trees? What is our emergency plan? And what is some sort of protocol to help people in need to deal with any extreme heat situations? The other thing that is a very big issue as far as environmental justice equity concerns in Worcester is urban flooding. And we've been reading about that for the last 2 years. And the thing with urban flooding is it ranges because you can have from the light rain where there's some mild flooding and it is annoying because you might have to, reroute your trip. But on the other extreme, it can also be quite life-threatening as far as people getting trapped in deep floods, being washed away. And so it's not something to be taken, lightly. So extreme storm events where there's this high precipitation really can result in increased stormwater runoff and flooding. We're working on some projects now where it is EJ flood vulnerability assessments. And that is going to have what I had mentioned, engagement with communities to say, what is your experience? Because they know, they've been there. And previously, many places you wouldn't engage, you make assumptions. But now saying they have a richer understanding. They may not be civil engineers, they may not be technical, but they're living it. They know exactly what's happening on what streets and then how things change and move. And to use that lived experience knowledge as a technical knowledge contributes to the overall planning for an urban flooding solution. So that engagement is really key. Coupled with extreme heat situations and urban flooding, a really big issue in Worcester is tree canopy coverage, and particularly a need for planting more trees. And there are many different reasons for that, for their cooling effect, their mental health effect, also planting trees, hopefully with green filtration system. So it's more green infrastructure that can be designed with rain gardens to help with some certain levels of flooding. So those are the three main overall topics that Worcester wanted to focus on. And we'll go to the next slide on regarding some of the other issues associated with those and what does it mean for public health.
So good to know. Thank you. So you said something about the impact of heat on pregnant people. We celebrated Black Maternal Health April 11th through the 17th, which was a really successful campaign. What are the connections between environmental factors and maternal health and also health in general?
And one thing I'm going to share is that I know it was mentioned it's like the last day of Earth Month, and you just had the Black maternal, I would say, week or time frame. I'm going to bring up that for UMass Chan, every day now is Earth Day. Every day now is Black maternal health awareness. It just is. And it ties into all the work that you're doing, whether you see it or not. I'm hoping to frame it so you do understand it. And want to, start with, again, that context. So we know there's a climate crisis. And the climate crisis does not affect everyone equally. And you say, like, why is that? And it can be for many different reasons, but there's some people that have more green spaces. They're not exposed to certain toxics. They, live in certain areas that you don't have air quality issues. You don't have water quality issues. You're not being exposed to, stacks or industrial practices happening near you. So that as these extreme events happen that can worsen air quality and have extreme heat and associated impacts, everyone is dealing with different realities regarding the climate crisis. And for people on one side of that spectrum, and it's a large group, it is life-threatening, and it's a critical issue. So while we know that generally, without the climate crisis, there is air pollution happening. We know that there are disproportionate, their populations being disproportionately exposed to different toxins. But then you add on top of that these extreme heats, rising temperature, and other factors, and it becomes a little bit more compounded. And so now you're dealing with people who've had to deal with psychological stressors around racism. They have pollution around undue burden of environmental injustices. But now you also have natural disasters and other things coming associated with the climate crisis, in which everything is somewhat worsened. And all of that adversely impacts the health of communities. But it's definitely more communities that have been marginalized by design. And it usually is low income and or communities of color. That includes indigenous, peoples with disability, and it also is rural. But there is an underserved, a historically underserved population that has always been exposed. Now, as we address environmental justice and equity, starting to revisit and reframe and move for solutions. But just the same, those populations are still being exposed to and harmed by the climate crisis. And so that's just the starting point. And to clarify the different levels a little bit further, I hinted at some, or just said them. I have the list here. So we know there's a chemical one. They're exposed to toxic waste or things that are exposed around them, whether they live near a highway or there's some industrial plant happening. But you also have, they could be near something where there's pesticides. They're also exposed to things in their home. There's lead in paint. There could be things that they're breathing in, they're exposed to on their skin, they're drinking the water in many different ways. Then there's also the physical, where it's like, wow, there's the noise pollution. There's also some other physical where you could have mold, you have floods, all this stuff, actually the biological mold. So you have then other things you're exposed to around the biological, and then I mentioned the psychosocial, which is very large because we're aware of how stress can worsen what's happening in the body, make it less resistant as it is being exposed to things that can foster disease, and seeing how it's a holistic approach and saying, wow, these communities of people are experiencing an unfathomable reality. And that is resulting in some scary and sad situations happening that can be addressed. So that's first, how the climate crisis does not affect everyone equally. We'll go to the next slide. So while we know that these populations are getting the brunt, there's one particular pool of people within this population that when there's toxic exposures coupled with climate change, that it really makes it so they're exposed disproportionately. And this one group, I'll have to say, is women, particularly because that's a sensitive window of susceptibility. Because everybody already is being exposed to toxins, but then you're in a fragile state of creating life and then bringing forth a life, whether you're also postpartum, you're breastfeeding, everything. It's a very sensitive time frame, and you're exposed to these environmental factors, and it's actually contributing to maternal morbidity and mortality. For this presentation, I didn't focus on those statistics. I know you have them and you can be exposed. I wanted to focus more on the human element aspect of what is happening and how it ties to environmental justice and equity, but definitely how these air pollutions, the water, the chemicals all around, what's happening with climate is negatively impacting the health of mothers and babies in these low-income, underserved communities. But I also want to say that while those communities themselves are usually populated by BIPOC populations, there's also something that's adding to what's happening with the maternal health crisis of BIPOC and Black women. And it has to do with implicit bias. That is a significant contributor equal to environmental injustices as well as with the climate. Because then when and if they do have access, when they do get care, their healthcare practitioners' limited perceptions and misinformation and own prejudices, whether subconscious or not, or subconscious, are making decisions. And it is adversely impacting, Black women and their babies. And so it's not an impossible situation to undo and be solutions oriented, but there are some aspects that you can focus on as we look at environmental justice, climate, implicit bias, and what that all means. And it comes down to that these pregnant women exposed at a vulnerable time have high temperatures around pollution, and their pain is not seen as much as severe as maybe somebody else's, again, through a healthcare practitioner's perceptions. And they are, as a result, suffering. And they're having preterm or underweight or other health aspects for themselves or for their baby, and they're suffering. So wanted to talk about what does that all mean and how can, a school like UMass Chan, where you're focused on creating public health practitioners, leaders, thought leaders that help drive that industry, how they then look at and understand environmental justice and equity, and what can they do to be a spark of light and a solution. And so this is all part of that conversation. One of the things I really want to also instill is understanding the overlapping of vulnerabilities. And I'm going to repeat it because I want to make sure it's anchored in. There are, everybody's exposed to climate, everybody here. But then if you're coming from a BIPOC low-income community that has environmental injustices, you're exposed to more. And then within that population, the pregnant, breastfeeding, postpartum women and their babies are really susceptible. And that is the big focus and concern, as well as knowing that these groups are living places where there's older infrastructure. So then what does that bring? They have risk of flooding. They have lack of access to care. And then, like I said, when they do have care, there's a potential for some bias, but hopefully not. And so they're really overlapping, and it's very convoluted, and it can be addressed. But as you, as a public health practitioner, start to think about your touch and how you engage with your communities that you're serving and your patients, having an understanding of all the layers in which there's overlapping vulnerabilities is an insight that will help you just stay open to how to best serve them. And I know it's rather complicated and each patient is their own, but just having an awareness of what is happening in their lives, again, from environmental injustice, to climate, to access, to bias, what they're exposed to will help serve you in understanding like what's going on with their health, because that brings many different factors as you try to assess what's happening and come up with solutions. And the reason I frame it that way, my stepmother is a doctor, and she's been in the field for over 40 years and loves it. And the approaches each patient where you're trying to understand when they're telling you what's happening, what is really happening, and it's a mystery, and you're solving it. But then to have that lens of understanding around those factors that I mentioned that overlap will help you solve it in a clear way. And even if there's still some areas that are unknown, coming in with a sensitivity to, well, I wonder from their environmental justice community, I wonder what they've been exposed to, I wonder how their access has been, wonder how their care has been, and what you've observed. You bringing that forward changes everything. And that's what I want to instill in you, what your role is, or what your role potentially could be.
Yeah, very, very important. I know that Serena Williams is probably not in an environmental justice community, but given it, just everything you talked about reminds me of her experience with her first pregnancy.
But while she's not in environmental justice by economic, by race, that's a huge another factor of environmental justice, as well as a huge factor in your health outcomes, not just from genetics or what you're exposed to, but how the care you get, and then the impacts from that. So race, environmental justice, race, and the health disparities, the same.
Yeah, yeah. So what are some action items that we can take as individuals and as the UMass Chan community, and maybe even specifically as healthcare practitioners and researchers?
Right, thank you. So the first one I have to say, and it may not even be on here, is you're doing it. You're understanding there's a problem, and you may not have the solutions, but you know to have a conversation. And that starts everything, because then together collectively in a community, that's where those conversations happen to say, I'm observing this. I don't know what to do, but we have to do something. And that's my hope for everybody here, because many times in my office, when we're talking about new areas or priorities to focus on, we're in the forefront, as you guys are in the forefront, and we're like, we don't have a clear model to follow. So it's exciting to be in the forefront. It can be isolating to be in the forefront, but who better? UMass Chan, let's drive this conversation. And so when we have conversations, it's so nice to be honest and say, like, I don't know what to do, but we're going to figure this out together and such. So having these type of conversations and opening up an awareness, because that's the spark that starts it. So one of the things I did want to highlight is that the healthcare profession, you guys are in a critical position, but it's underused. And I think over the next few years, 3 to 5 years, there will be a shift in the role of public health in addressing climate crisis, yet alone health disparities associated with it, and just in the health industry, because you guys will be witnessing, and I'm similar to, and I don't want to offend anybody on the COVID, you're the front lines. And so in the climate crisis, these are public health issues. And as we have more extreme heats, as we have associated diseases coming from climate situations that create a perfect space for things to thrive and then to bloom into an epidemic or a pandemic, your insight and awareness of how you move is key. And hopefully it's never as big as it was before, but even if you're just dealing with a patient that has different issues, you're like, wow, what is that, again, overlapping vulnerabilities that they've been exposed to that helps tell their fuller story. And so one of the things that you can start to look at is contributing in the conversation. How do we help prevent this? And that's a hard one because it is very convoluted into many different factors, which is a whole nother discussion. I won't even bring it up. But you can start to think about in your group, okay, we need to talk about prevention, just as you talk about prevention of other diseases, start to talk about how can we address climate health, environmental health, and help prevent that. And that comes down to being an advocate and helping to support, policy or public health studies around pollution and say we need to start to prevent how we're allowing pollution or how things are permitted or how things are allowed. And the voice of public health is profound. It used to be economics was a driving factor, but you bring in public health, that's a whole nother level because that gets everybody's attention. And what used to be an environmental health issue for low, moderate income BIPOC communities over there now is a public health issue for everybody. And that's really what has driven this. If it was always just happening as it had been in the 60s and the 70s to marginalized communities, I think their fight and presence would have brought it here. But really what made a nice tipping point, I will just say, is that these environmental issues, public health issues affected everybody, coupled with some other things coming to a point. So how can you be part of helping with prevention? How can you understand knowledge sharing and helping sure that the education and the workforce is looking at ways to contribute to climate change and health issues and maternal health? What does that look like in education? What does that look like in training? And one thing is you can always do is create a guide. I know my office is like, wow, we're going to do a best practices guide, just a bulleted list on different subject matters and say like, wow, how can you, for whatever subjects that you guys think about, like, how do we have a guide for healthcare leaders, institutions regarding creating this health system that understands these overlapping issues? What to look for, how to engage with communities, how do we get solutions, how do we test this, what are we doing, and have that be something that it's a living document because based on experience and expertise, it will change, it will morph, but create what are our guidelines for practitioners as you're working at hospitals, working with communities, and start to think what that shapes. So planting some seeds of thought on how you gather as a community, the conversations that you have, and what does that guide look like as far as, again, those overlapping issues, which are environmental injustices and what they've been exposed to, coupled with climate crisis, coupled with access and implicit bias ramifications and such. And how do you address all of that? Because they are interacting together. We'll go to the next slide. So some of the actionable strategies, just to still keep it a little high level but absorbable. As I said, awareness is key. And you guys are doing it now. It was my hope to make you further aware, and there's more information online around environmental justice communities. And really, what are they? And it's sometimes not who you think, because it definitely is based on race. And that race can be from low income to also moderate income and more, because it's usually race is a big factor for how things have been done with, banks and zoning, and then what people are exposed to. And so it's not always just low income, but it does include them as well as moderate. And it's also rural. It's not always urban. And you can have rural and you can have low income, and you can also have white. And sometimes that population is left out of that assumption around what is environmental justice and equity, but it goes across. So we have to make sure your equity is equitable and that it is across the board, because it does include low income, it does include white, and it includes immigrant, it includes indigenous populations. So usually a group that's not too market rate mainstream. And understanding, as I mentioned, their disproportionate burden based on what is housed near them because of permitting and policy and zoning and such. And that those environmental hazards create a public health issue across the board. And how to look at that, in situations and see clusters that have not been identified before, but you put it in a framework of that. You could look at unhealthy land uses. You can look at psychosocial stressors. You can look at historical traumas. And one thing I'll share, and I think I mentioned this earlier when I was talking with the planning team. So in the 1990s, I did work for a group that was Frederick R. Harris, now AECOM. And while everything now is environmental justice today, we did an environmental justice assessment to determine if this one community, I think it was Winthrop, was an environmental justice community being adversely exposed to mass ports routes. And so at the time, there was, it was an interesting topic because at the time it was a moderate income, I believe, Polish American community, which is not environmental justice. So I said, right off the bat, the answer is going to be no. There's no environmental justice situation here because it's not environmental justice. There is a public health issue because they did have many clusters of rare cancers, including my supervisor. And she worked on that, but she said she's a client and you're a consultant to a client and it happens. So then now, years later, working on a project with, on the other side of the table, see that proponent come forward with a public health discussion, and it's about asthma. And I totally understand it. That's a public health issue. And I'm thinking, why are we talking about asthma solely when over 20 years ago, we were talking about it with cancer? Where did that drop off to? And why is that not at the table? And bringing that back up. So being aware of, well, what are they talking about? And it's like, oh, it's really great they're talking about something specific, but is that the whole story? And thinking about that, particularly as you think about environmental justice communities and what they're exposed to, and how will that reveal itself, you know, after like 15 years in the body with bioaccumulation and such. And so as you think about awareness, think about it in a critical, creative way of like, is that the only story? The other part too is around supporting and advocating. That's the best part ever. And that has to do with being part of cumulative environmental health burden assessments to say like, wow, how can we be part of this? How can we help with this public health issue? The biggest thing on that second bullet is you as practitioners, you may not be doing certain things, or you may be because it's unconscious, but you will be observing situations. You may observe inequities. You may observe mistreatments that happen to people. And what is your voice to advocate? Because if you're silent, that perpetuates it. But there's a way to be a leader to help shape it and provide a structure for that whole facility, then to do better, be better, serve better. And that voice is needed because one of the things that eventually, I'm glad to say that while there's so many inequities happening, mistreatment, it now does get publicized. I don't know what percent, not all. And that as you speak up, it's even to say, we want to protect the reputation of the organization that you're with, because if this ever does get out, it really would be a setback. And so also to say, there are many reasons why you want to do something. It's the right thing, but then also you also want to foster a strong organization that does the right thing. And so there can be many reasons why you do it, but do speak up, do see. And then better yet, say, we're going to have a guide, because regardless of what people may think, there's unconscious bias. So with the best intentions, you may not be aware of what is also happening or your assumptions and how that is adversely impacting, particular patients. And say, well, how are we looking at this? The other part is, in addition to that inequity around like Black maternal health and associated Indigenous, is looking at cultural considerations across healthcare, because in Massachusetts, such a wide range of people from around the world, and they have different cultural understandings and practices and nuances. And having that awareness as you engage with populations will serve you and your practice on, we really need to be aware and sensitive so that there's better engagement, which helps with serving and having a better practice for what you're offering. And the other one is inform policy. I know that there are many ways to get involved to help shape policy at the legislation, or just in the municipality on public health and the role that it plays. I think there might be one more too. Yeah, we'll go back one more. The other part is, preventing, as I mentioned. You guys are a critical role, healthcare practitioners. You shape the practice that you have, you influence your peers, you're part of research, you are part of interactions with communities. And so as you step forward, come with like an understanding of these overlapping vulnerabilities. This is a guide, these are the things to be aware of. Then engage with the community. Engage with the community in a new way. And this is something that is really exciting because, as I before was trying to drive awareness into multi-sectors, players into engagement with community, framed it as a competitive edge. And so there's many ways for why to do it. You want to understand what is happening in the community, is work with partners. They're community-based organizations, faith-based organizations, community centers, they're climate groups in Worcester, they're public health groups, and they're aligned. And if you start to engage with them and say, we care and we want to listen to what you know and hear about it, you don't need to go in there. It's like, we're not sure where this will go yet. But when you listen, that will help inform you on how can you best serve that community as a way to improve their health, to improve the community's understanding and such. And better than just partnering with communities, do multi-sector collaborations, because it takes everybody. That saves time, it saves resources, and you as a school can work with the community. You can also work with some of the businesses, the municipalities, because if you can't stay in a silo or else it stays in a silo, it's got to be grassroots coupled with municipality, coupled with the healthcare industry, but engaged in co-leading with the communities. And so I'm excited for everybody who's been on here. It has been my hope to ignite in you an understanding of environmental justice and equity in the public health context and what it means as a healthcare practitioner when you engage, to have that awareness of what are the things that are happening that people are exposed to and why can't they just move? It's like, why couldn't they just do something else? It's so complicated and convoluted, and it's not easy. And just say, you know what, it doesn't matter. They're here. This is your understanding, and how can you serve them? So I wish you tremendous success in all that you do, and that you connect together and continue this conversation. So thank you.
So great. Thank you, Crystal. Such important information and resources. Thank you. Yeah. So just because of time, we may be able to get 1 or 2 questions from the audience. So if you would like to ask Crystal a question, please raise your electronic hand or indicate in the chat, and I will read it for you if you have a question. And yeah, we'll spend maybe 2 or 3 minutes on questions.
Can you read the question?
Sure. So there's a question from Kenneth Wilson in the chat.
Yep.
What advice do you have for people who want to get involved in the local environmental justice work, but don't know where to start?
That's a great question. If you're talking about in Worcester versus wherever you are, you really can just do a Google search and say Worcester Environmental Justice Organizations. And that's a great start. Or you can also email me. You literally can email me, and depending on where you are, because we have, we're tracking by region and then area. So if you're like, oh, I'm in this area and I want to find out, if you can either do a Google search and find out, and talk to about 3 organizations and cross-reference information that way. You can also probably ask a faith-based organization or community center, who are the organizations that they may know of? And again, you have to make sure you're asking, the right person at the right time, so they understand what you're asking. They can give you information that is useful. But when we do engagement, we go into a new community, I would do what you do. I do a search of who are all the different environmental, climate, every type of alternative word you can think about search. Keep a list, cross-reference, engage them, ask who they also know, and you narrow it down from there. Then from there, you can find out what their mission is and their focus, because thankfully there's a wide variety and there's some overlap, but there's also some distinct paths, and you can get involved that way. And you can also reach out to me. I'm glad to help you find something that works for you.
Great. We have another question in the chat from Tracy Neville. How can we learn more about ingredients in household products that are harmful? Do you have resources?
You know what's so funny? I'm going to tell you this. My mom will verify it. When I was in 8th grade, I made her take me to a health food store, and I remember reading the labels then, right? Because I've always, in 2nd grade, I've been into the environment and knew labels changed from the 60s to the 70s, 80s, and yet alone now it's really changed. And you can Google that question, but I'll say, I think it's Environmental Working Group. I could be wrong. I think that's the name. They have a great website that, like, even down to like, what sunscreen product do you want to use that has less chemicals? But you do have to learn about ingredients in your cleaning products, and be aware of how much you're exposing yourself to. Because I thought about that earlier today, because I went to the health club, and then people spray the equipment in between. I'm like, and it's a biomedical cleaning spray, so you know it's intense. And I was thinking, wow, how am I breathing this in? Then you're going outside, and there's a car going by. Then you're just exposed to so much. And so in your household, how to reduce that. And one of the things you can do, even though you can go to a health food store, and there's some that are a little bit more cleaner than other, like there can be one like a little bit more holistic. I love Whole Foods, but they also have some products and that have some ingredients that some more sensitive people may not want. But that's a start to find out Environmental Working Group and looking at products. There's tons of information online for you to familiarize yourself with what are the ingredients, or then how can you make something yourself? You might say, you know, I'm just going to do something with vinegar, oil that's really, really clean, because you've always had people who have been environmentally sensitive and have had clean products before you had these Whole Foods taking over the bread and circuses and the other smaller ones. So you can find that online to have a cleaner home and a cleaner office.
Great. Thanks so much again, Crystal. This has been such a impactful and information-packed hour. Thank you.
Thank you.
So I want to make a plug that our committee created a library guide that has a bunch of resources that our community can go and reference and see the report from Crystal's office and lots of other really great resources. So I encourage you to go there. And also Crystal's information is on the screen, and she's invited you to reach out to her personally. What a generous invitation. Thank you.
Yes,
so
most definitely.
Hand it over to Courtney to close us off.
Thank you, Janine, and a big thanks to you and to Crystal for leading such an awesome discussion today. Just a plug that I will send out all of those resources to the attendees on this list after the call, so that you have the slides, as well as the LIB guide that Janine mentioned and the Environmental Justice Action Plan from EEA. Let's remember that this conversation does not end with Earth Month. Like Crystal so poignantly mentioned, this is an everyday kind of deal for us at UMass Chan. And so let's continue to work together to advance environmental justice in our communities, as well as climate action in our communities. If you have any questions or you'd like to get involved a little bit more, feel free to reach out to sustainability@umassmed.edu for more ways to get involved. So thank you all for joining us today. I hope you have a great rest of your week.
Thank you.
Thank you so much, everybody. Bye.
Bye.